There are things you can do at that first appointment that will probably help your pet and are very unlikely to cause any side effects or negative effects. First, let's talk about diets. There are two diets which have scientific evidence that show that they either slow or reverse the signs of cognitive dysfunction in dogs. One is Hill's BD diet, and the other one is Purina NeuroCare. And I get 100% that everybody's got an opinion about diets. Have your opinion, but veterinarians are scientists, so we're going to follow the science and recommend one of those two diets. One supplement is Senalife. Senalife has a group of ingredients: phosphatidylserine, resveratrol, vitamin B6, ginkgo biloba, and other ingredients that have been shown in dogs to slow the signs of cognitive dysfunction. There's also Denamarin. Denamarin has a really powerful antioxidant in it called SAMe, S-adenosyl methionine. This has been shown in senior dogs to slow the signs of aging when the dogs already have signs of CDS. So we are going to start dogs on those supplements or those diets immediately at the first appointment. I get a lot of questions about whether or not these diets and supplements are preventative. We have no evidence that they are preventative. However, we do recommend that any dog over 10 go on a brain diet and on Denamarin and Senalife in case they are protective, and that is what I do for my own dog. We've been getting questions about what we can do for cats who have signs of CDS. We want to use products labeled just for cats. They're not little dogs and they're not little people. They have their own needs, and certain ingredients that are not toxic to dogs at certain levels are toxic to cats. So cat products only. So we have a small number of choices. We have Senalife. It has ginkgo biloba, phosphatidylserine, vitamin E, vitamin B6, and resveratrol. So you can use that in cats. You can also use Denamarin. Remember that Denamarin has that powerful SAMe, which is an antioxidant and also helps the receptors in the brain and regulates some of those really important neurotransmitters that decrease as your cat ages. Get the cat labeled Denamarin. Regarding diet, wow, we don't have any choices. We know that some of the ingredients that work for dogs do work for cats, but the diets are not readily available. Then there's the question of when should you start these supplements? We don't have evidence that they're preventative. However, I start my pets on these brain supplements as soon as they hit that age threshold, which for cats is 10 years. A client asked me the other day if she could give her dog her anti-aging supplement. No, don't do that. That is really, really bad. Here's the thing. Dogs and cats are family, but they're not little human beings. And some of the stuff, even vitamins, like vitamin D, that you might find in your anti-aging supplement may be at toxic levels for your dog and especially your cat. That also goes for crossover between dog and cat supplements. If you're going to give something to a cat, it has to be labeled for cats. Next, let's talk about ingredients. Let's take, for example, MCTs, medium chain triglycerides. This nutritional ingredient has been shown in older dogs to reduce the signs of cognitive dysfunction. What people are telling me is that they're pouring coconut oil all over their dog's food to try to get their dog those MCTs to help with brain health. But here's the problem. MCTs and coconut oil are not the same thing. MCTs are refined, and studies show that certain levels help with CDS, higher levels don't, lower levels don't. So you got to get that exact percentage. What you will do by putting coconut oil all over your dog's food is you'll make your dog gain weight, which also is not good for overall health, quality of life, or longevity. So if you want to use medium chain triglycerides, buy a dog food such as Purina NeuroCare, which has the right amount and has clinical evidence that it works in dogs. Now it's time to talk about medication. There's only one medication approved for use in the US for the treatment of cognitive dysfunction and only in dogs, and that's selegiline. The brand name is Anapril, and we always try to prescribe the brand name if we can. Here's the thing, selegiline is a fantastic medication, but it's in a class called MAO inhibitors. And do you ever listen when you hear those ads for medications, how they say, do not take if you're taking MAO inhibitors? Right. So MAO inhibitors can interact with a lot of different medications. So it's not that we don't use Anapril. We do use it, absolutely. It's that we use it with the knowledge that we have to check other medications that we're going to prescribe with that extra little percentage of accuracy to make sure there's no interactions with the medications that older pets are on, because they're usually on several medications. We also want to think about what we're treating. A lot of dogs that I see that come in with complaints of signs of CDS actually have anxiety that they've had for their entire lives or most of their lives, and now it's just worse. Those dogs may not need a CDS medication. They might need diet and supplements for brain health, and then medications that actually work on that anxiety, which might be antidepressants or short-term anxiolytics. Another way to approach this is to use medications to kind of modulate those clinical signs, and then to use diet and supplements to improve brain health. For example, if I have a patient that doesn't sleep at night and that is the primary clinical sign, then I can use a medication to help them sleep at night. Will that slow the signs of CDS? No, but the supplements and the diets should help with that. So there's different ways to approach medications for CDS. As usual with behavioral medicine, one size does not fit all.